Hello, everyone. This is Nurse Sarah, and today I'm going to be talking to you a little bit more about managing diabetes. I'm going to share my screen so that we can go ahead and get started. All right, so we are going to talk more about managing diabetes. The goal today is going to be to learn more about diabetes and how to take care of yourself at home. We'll talk about what diabetes is, facts about diabetes, symptoms and risk factors of diabetes, long-term complications of diabetes, and self-management tips. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to damage to the heart, blood vessels, eyes, kidneys, and nerves. When blood sugar levels rise after you eat, your pancreas releases insulin into the blood. Insulin then lowers blood glucose to keep it in the normal range. People with diabetes have trouble with the amount of blood sugar and insulin levels in their bodies. Today, we're going to focus on learning more about diabetes as well as tips to help manage it in order to limit or prevent these complications. Many people have diabetes. 1 in 11 Americans has diabetes, or about 9%. Some areas of the country have more people with diabetes than others. In certain parts of Chicago, like areas on the south and west sides, this can be as much as 1 in 5 people, or 20%. This can be due to a lot of factors, such as genetics, diet, and activity, which we'll get into shortly. There are 4 different types of diabetes, though for this presentation, we'll mainly be focusing on type 2. Type 1 diabetes mainly happens in childhood due to genetics. This is sometimes called insulin-dependent diabetes, or you may have heard it referred to as juvenile diabetes. People need to give themselves shots of insulin daily to survive when they have type 1 diabetes. Type 2 diabetes is the most common type of diabetes and the type we'll be discussing today. It's sometimes called adult onset diabetes because it usually comes on in adulthood. It is becoming more prevalent in children, however. This type of diabetes is when your body can't respond to its own insulin and people need to monitor their own blood sugar. We'll focus on steps to prevent and manage diabetes today. Prediabetes is when you have above average blood sugar levels, though they're not high enough to be considered type 1 or type 2 diabetes. This is an important type because it's the only one that you can actually reverse. If you take the proper steps early enough, you can prevent ever getting diabetes. Gestational diabetes is when blood sugar levels are higher in pregnant women. Some women have higher risks than others, such as if they have heart disease or a heavier baby. Usually, the diabetes goes away after delivery, though sometimes these women are at higher risk for diabetes and other health complications even after delivery. If you have or have had gestational diabetes, talk to your provider about next steps and what that means for you. The main symptoms of diabetes are excessive thirst, frequent urination, sores or wounds that take a long time to heal, sudden weight loss, blurry vision, excessive fatigue, numbness or tingling in your hands and feet, and excessive hunger. Sometimes people don't know that they have diabetes. If you notice these symptoms, make sure to talk to your provider about doing tests to see if you have diabetes or are pre-diabetic. There are several risk factors for diabetes. Some you can't control, like your age, race, or genetics. But there are many factors that you can control, and we'll talk about those in a few minutes. These risk factors include managing your weight and your physical activity. There are a few tests your provider can do to check and see if you have diabetes or are pre-diabetic. The most important one is the A1C test, which measures your average blood sugar over the past 3 months by a simple blood test. It's the main test to help you and your healthcare team manage your diabetes. Talk to your provider and make sure that you're getting your A1C checked at least once a year, especially if you're over the age of 45. A fasting blood sugar test measures blood sugar after not eating or drinking anything for 8 to 12 hours before the test. It's a simple, safe, and common way to diagnose prediabetes, diabetes, or gestational diabetes. A healthcare provider will prick your finger or use a needle to draw blood from a vein in your arm. A glucose tolerance test checks how well the body processes blood. It involves comparing the levels of glucose in the blood before and after drinking a sugary drink. The results of this test can help doctors to detect type 2 diabetes or prediabetes. A blood sugar test can measure blood sugar at any time. You can use a device called a continuous glucose monitor or a CGM, or you can test your blood sugar at home with a portable electronic device called a blood sugar meter using a small drop of your blood. If left untreated, there are many complications from diabetes, including heart disease, nerve damage, kidney disease, skin infections with possible amputation, Alzheimer's disease, eye damage, and hearing impairments. This is one picture of possible ulcers on a foot as a result of diabetes. It is possible to delay or prevent all of these complications if you manage your diabetes appropriately. Maintaining a healthy weight is one of the biggest things you can do to manage your diabetes. If you are overweight, talk to your provider before starting a diet or exercise program and have them help figure out what a good goal weight is for you. Even just a little bit, like 10 to 20 pounds, can help you get started and prevent complications from diabetes. Weight loss can help you in other ways too, such as less pain from arthritis, better sleep, and more energy. There are many ways to modify your diet to make things healthier, help manage your weight and your blood sugar. Avoiding fast foods in favor of homemade meals is probably the biggest piece of advice, but sometimes people think that is more expensive. Frozen meats, fruits, and vegetables, however, are just as healthy as fresh without breaking the bank. Try going to the grocery store for fresh or frozen fruits and vegetables and avoid processed foods with extra sugar and salt. For sweet cravings, try berries and other fruit instead of cookies and candies that can spike your blood sugar. White breads and pastas tend to spike your blood sugar as well, so try whole grain alternatives or brown rice instead. They also tend to have more flavor. Sodas and sugary drinks tend to spike your blood sugar, so instead try water with fruit or a sugar free drink like Crystal Light. Physical activity can make you feel better, function better, and sleep better, as well as help your weight loss. The American Heart Association recommends at least 20 to 30 minutes of moderate physical activities at least 5 days a week. Figure out a way to incorporate activities that you enjoy doing, like dancing, playing with your grandkids, or walking. Bring along a friend or a family member to make it even more enjoyable. 2 days a week, try to incorporate strengthening with weights or a resistance band. Keeping track of your blood sugar is important to prevent or delay long term damage such as heart disease, vision loss, or kidney disease. Your provider may or may not recommend monitoring, so talk to them about what is right for you. They may recommend using a glucose monitor, like in this picture, or having a wearable device like Dexcom that sends blood sugar information to an app on your phone. If you monitor your blood sugar, track to see what makes it go up and down and try to keep it between 80 to 100 milligrams per deciliter. As always, make sure to take your medicine as prescribed in addition to monitoring your blood sugar. When you have diabetes, in addition to managing your blood sugar, your weight, and activity, it is also important to prevent other complications. Make sure to check your feet every day for cuts and blisters. Sometimes it can be hard to feel your feet if you have diabetes, so checking your skin can help make sure you stay healthy. Talk to your provider about medications that are right for you and make sure to take them as prescribed. Also, talk to your provider about getting your A1C and kidneys checked regularly. If you smoke, try to quit. Smoking limits blood flow to the body, which can help make complications worse. Talk to your provider about resources that can help. Brush and floss your teeth and have regular dental checkups to make sure your teeth and gums stay healthy. Keep track of your blood pressure through your provider or at home if you have a monitor to make sure your heart stays healthy. It is possible with appropriate management to prevent getting diabetes, or if you already have it, to be able to keep normal blood sugar levels without medication. Diet changes, activity levels, weight loss, and monitoring your blood sugar are all important steps to make sure you get and stay healthy. This presentation covered information about diabetes as well as tips to manage it. But keep in mind that everyone is different. Some people may have different recommendations from their provider than others. So make sure you talk to your provider about what specific instructions they recommend for you. Thank you all for watching, and I hope you have a great and healthy and safe rest of your day. Bye.